Good morning and welcome to Asake Online. My name is Lesley Moyo and the program is On the Pulse, where we focus on service delivery issues in Matebeleland. On the program today, we are joined by the Director of Health Services in the city of Bulawayo, Dr. Edwin Sibanda, to speak to us about the city's health service provision in the midst of COVID-19. Welcome to the program, Doctor.
Thank you.
As we start the program, maybe you can briefly explain to us the work that you do in the city of Bulawayo.
Well, the city of Bulawayo, city health department in particular, is tasked with taking care of the personal health, which is the clinics, where we run 19 clinics plus one infectious disease hospital, Dongrove in particular. And in these clinics, we offer basic primary health care services in the form of immunizations, antenatal care and deliveries of pregnant mothers. We treat minor ailments as well as tuberculosis and TB services. We also offer other testing services for basic screening such as cancers, diabetes and hypertension.
Currently, we are operating in a very difficult time because of COVID-19 pandemic. How has the city of Bulawayo managed to maybe modify its services to fit into this time, especially now that Zimbabwe is also under lockdown?
Well, what has happened basically is this COVID-19 or coronavirus outbreak, it has made us aware that we need to observe certain rules and regulations such as social distancing, things such as hand washing or usage of sanitizers and usage of facial masks. So what we have done at all of our clinics, we test temperatures and we provide hand washing facilities and or sanitizers whenever available. We have had a lot of generous donors who have given us a lot of sanitizers, and those are in use at our clinics. And we have maintained the opening and closing times because we have felt that if we either reduce the hours or change the number of days of opening, we will end up with people congested and therefore unable to observe the social distancing that is so required. What we have done with routine patients, those that collect their medications on a monthly, weekly or quarterly basis, we have extended the times or the duration of supply. For instance, with tuberculosis patients, those in the intensive phase who do not have any complaints at all, we can supply them for a full month if our stocks allow. And those that are in the intensive phase, we supply for 2 months, such that the frequency of coming to the clinics is reduced. The same will apply to those who are collecting antiretroviral treatment from our clinics. Ordinarily, we supply them for 3 months, but if stocks do not allow, we supply them for shorter periods. But we desire that all people collect their medication every 3 months. That way, we reduce the number of visits to the clinics, and therefore we're able to concentrate on those that are very ill and require attention by the healthcare givers. Also, those that are stable, and even if they are coming more frequently, we make sure that they spend as short a period as possible at our clinics, and those that would be coughing are given masks to ensure that they do not spread the cause of the coughs and we also have small isolation centers where people will be isolated prior to the rapid response teams being called to verify whether it could be COVID or not.
Okay. And can residents of Bulawayo still access these facilities, especially during this time of COVID-19? And are there any services that maybe you might have suspended or have added in response to this pandemic?
We have not added any services except the checking of temperatures at entrance and the washing of hands at our entrances to our facilities. Those are the things that really have been added in these small isolation corners awaiting the arrival of the rapid response teams. The rapid response teams ordinarily are not there at the clinics or in the city health department, but now that we have COVID, they are more active. Instead of having one rapid response team, we have expanded them to 5.
Maybe you can tell us more about the rapid response team. What is their main purpose?
The main purpose of the rapid response team is to respond to calls by residents who may suspect that they've got an infectious disease, because we do not encourage people that suspect that they have an infectious disease to actually come to our facilities, because in the process of trying to come to our facilities, they may spread the infection if it is an infectious condition, in this case COVID-19. So we encourage people to contact our call center, and from the call center the call will be directed to the rapid response team, and usually the rapid response team will respond first by phone call to ascertain that the symptoms and the history are consistent with an infectious condition, in this case COVID-19, before people are dispatched to the residence of that particular person. Yeah.
And then
when they get there, they would then collect a sample. They will obviously verify the history and marry it with the symptoms, and if it is really indicative that someone may be a possible contact or a possible case of COVID-19, that person would then be, a specimen would be collected, probably a rapid test on site, as well as a nasopharyngeal swab or sample, which will go to the laboratory. Now that the testing is done locally in Bulawayo at the National TB Reference Laboratory.
And once those tests are done and they are confirmed, what is the process that follows after that?
Someone who is positive for the rapid test, or the rapid test, COVID test, would then be told to self-isolate at home if they are in a clinical state that allows them to do so. If they are not in a state that allows them to be isolated at home, they may be moved to an isolation ward, currently Thorncroft being the only place where such a facility exists. But the sample will then go to the laboratory. The turnaround time for the results, the confirmatory results at the laboratory, is around 24 to 48 hours, depending on what challenges we may have. Because the sample may be taken late in the night and arrive at the lab and find the lab so busy that the results may not be out within 24 hours. And if the results are positive at the laboratory, the person will be contacted by the rapid response team, and the results conveyed to them physically. Those who are negative, they will be visited, but because they no longer fall in the emergency part, there may be a slight delay in delivering the negative results, because this rapid response team or teams are responding to a lot of calls within the city.
Speaking of Thorncroft Hospital, since the first confirmation of a COVID-19 case in Zimbabwe, we saw a lot of work being done, especially to bring the hospital up to speed in terms of responding to this pandemic. Maybe you can share with us briefly what has been done and where are we standing now with regards to Thorncroft Hospital?
What we as of yesterday, the 22nd, yesterday was 22nd?
Yes.
Yesterday, the 22nd of April, The isolation ward at Thorncroft was closed for renovations to make sure that when it opens in 14 days' time, it will be ready to admit patients and treat those that are mild to moderate effectively, unlike what we had previously. And the rest of the hospital is also going to receive a facelift, thanks to donors as well as the central government, which has provided some funding for that activity. The funding that we received so far is amounting to about 10 million Zimbabwean dollars so far. And that from the donors, some donors are donating their labor and materials, and that is yet to be quantified.
Okay, the main question was also with regards to equipment. We know of life-saving machines like your ventilators and other important equipment.
Ventilators, yes, we will are actually life-saving, but the response, the city response, or should I say the provincial response as Bulawayo, is that the ventilators will be housed mainly at Egusileni. We may have 1 or 2 ventilators at Thorncroft, together with a supply of oxygen, a piped supply of oxygen. That means a continuous supply of oxygen. In that way, those patients who will deteriorate, moving from mild to moderate and probably to severe, are the ones that will be ventilated at Thorncroft, but with the intention of transferring them to Egusileni for continuation of care.
Okay. And obviously, COVID-19 has altered the way that we've been living our lives. Maybe in terms of encouragement, what would you encourage the Bulawayo residents maybe to continue to do in terms of personal hygiene, even after we've managed to combat COVID-19?
I think certain things may never be the same in our lives after COVID is over or the lockdown is over. For instance, the gathering at funerals. We must now start questioning the wisdom of 500 people attending a funeral wake or a burial, because most of us there will be attending there and probably not even adding value. So people will now have to relook at their numbers at funerals, at weddings, at parties, and how far they stand from each other, and what do they do when they are there, and how long do they stay at those parties. We may need to continue washing our hands, using sanitizers, and maybe facial masks may become a permanent feature for the foreseeable future, because we do not know how long this COVID is going to be around, and after COVID, what other respiratory condition we may get. So I think we better get used to washing our hands. We better get used to social distancing, as we are hopefully practicing during the lockdown and this COVID outbreak.
Maybe just to take you back, you mentioned that Thorncroft Isolation Center is closed to make way for renovations. What happens, maybe there's a case where someone needs to be isolated during that period when the hospital is being renovated?
It is not the whole hospital that is being renovated, or there is still some space that can be created for those few patients. So our prayer and hope is that these renovations are quickly done and the hospital reopens to take care of the patients that may come soon after the renovations are over.
Thank you so much, Dr. Sibanda, for joining us on the program.
Thank you.
That was Dr. Edwin Sibanda, the Director of Health Services in the city of Bulawayo, speaking to us about the city's health service provision in the midst of COVID-19. Join us again in the next edition of On the Pulse. I am Lesley Moyo.